Lung ablation is an important field and it's growing. It's important to be able to offer these treatments to more and more patients. And although it can be challenging, this is very important to have this additional way to treat these patients beyond SBRT and surgery.
Lung ablation today is a well-established technique that enables us to be present at tumor boards, both in the primary setting as well as in the secondary setting. In the primary tumor, in this moment, according to international guidelines, we are after surgery and SBRT. But in case with non-operable patients with limited lung function, ablation can be a great option, also in case of a local recurrence. In the oligometastatic setting, the evidence is far stronger and support us more in the multidisciplinary tumor board. Indeed, we are present as an option at the same level with the SBRT in many settings, such as colorectal metastasis, liver metastasis, such as kidney metastatic setting, and sarcoma or melanoma, so many metastatic tumors that can benefit of our treatment. And the findings are very good when we compare surgery, SBRT, and ablation in this specific setting. We see that there is no difference in terms of overall survival and comparable local recurrence. In the lung setting, we can use all the technologies, RFA, microablation, and cryo. According to international standard of practice, both the Americans as well as the European, there is no evidence of superiority or inferiority of one technique above the other.
Ablation have the major advantage that you have no negative impact on the pulmonary function. Means that you can retreat your patient. The patient will have a follow-up. It will be followed at least for 2 years. And if during these 2 years you have a relapse, you can retreat with ablation because you have no negative effect on the pulmonary function of the patient, which is of course a little bit different after surgery or radiation therapy, but ablation allows interventional radiologists, interventional oncologists to retreat the same patient at the same location.
Lung ablations and combination with immunotherapy is a huge topic. Actually, we've seen that ablation is an immunostimulating treatment. There are studies that are exploring this combination synergy, specifically in lung tumor patients. We have preclinical data that are very promising. We have some case series that are also very interesting. And we have a prospective randomized trial. We have CRIOMUNE, which is led by Jean-Paul Lussière, which is a national study in France that will bring the evidence that we're seeking for.
If there's a message that I could send to our residents or our fellows, what I would like to tell them is, if you're not offering your patients this possibility, you are making them missing opportunities to lengthen the overall survival, and in some situations even to be cured.
So especially this ECIO 2026 is really focused on lung. We have the basic courses, we have essentials for ablation. We are talking about treatment of patients with lung metastasis, treatment of patients with lung cancer.
ECIO is the right place to be to build these practices. You have radoncs, you have medoncs, you have IR surgeons all gathering together. And we learn from each other how we can adapt these treatments in the best way to improve patient outcomes. So, working together, gathering all the specialties, this is the DNA of ECIO.